Welcome to the Think Small podcast, hypergrowth for small businesses. So, what's slowing you down?
Well, hello, everyone. Welcome to the Think Small podcast. I'm your host, Denise Steinbring. And if you've been following this show, you know we've recently spoken to a lot of people from the DC area, including Chinyere Hubbard from the DC Chamber of Commerce and several small businesses from that local area. Today's guest is connected to that same ecosystem, but she comes at it from a completely different angle. She's not a traditional entrepreneur. She did not raise venture capital. She did not launch a product in a garage. What she did was arguably harder. She was appointed as the first and only employee of a government agency that did not yet exist, handed 10 months and a federal deadline that was legally immovable, and told to build, from scratch, a technology platform, a team, a policy framework, and a functioning health insurance marketplace for the entire District of Columbia. The federal government's version crashed on the same day that hers opened. Only 4 states in the entire country made that deadline, and DC was one of them. Mila Kofman is the executive director of the DC Health Benefit Exchange Authority and DC Health Link. Her organization now has 101 employees, $30 million in an annual budget, serves over 100,000 DC residents, and provides health insurance to more than 5,300 DC small businesses. It has also cut DC's uninsured rate by more than half. Amazing, Mila. It's such a pleasure to have you here. Welcome to the Think Small podcast.
Thank you.
Can you tell us a little bit more about the DC Health Benefit Exchange Authority? That's a mouthful. What is that compared to what people would normally think of as, health insurance that they need to go get?
Yes. So we are a private-public partnership, and we were established by DC policymakers to develop and operate the Affordable Care Act health insurance marketplace. And here in DC, we call it DC Health Link. As a private-public partnership, we can do certain things that government does. We can do certain things that the private sector does. And DC policymakers wanted to create our own instead of relying on the federal platform, because we wanted to make sure that what we do works for our residents and for our small businesses.
Great. And you are a lawyer by background, right? I think you've described yourself as a recovering ERISA attorney.
Yes.
Years at Georgetown as a research faculty member, and in Maine as superintendent of insurance before you were appointed as DC HealthLink's first employee. So what prepared you for a job that had never existed before, and what definitely did not prepare you for it?
So in all of the different hats I wore, I learned how to lead. In Maine, I was superintendent of insurance, and I led a fairly large state agency, a regulatory agency. We, of course, regulated all of insurance, not just health. I learned many lessons, how you successfully lead an established governmental agency. While I was on faculty at Georgetown, I had smaller teams I led in studying private health insurance markets and also advising after the Affordable Care Act was passed, different strategies, how to implement the Affordable Care Act. So I knew how to lead teams. When I came in as the first employee into my current role, it was, I would say, organized chaos, unlike anything else I've experienced. We had to build an IT system where there was no blueprint. There were no lessons anywhere. States that decided to build their own were looking at each other for advice and help. There was nothing else to look at. We had to make significant policy decisions very quickly, and we wanted to really build from ground up, not top down. So we formed many work groups and had community folks participate. We had employers at our table, patients, providers, our health plan partners, all helping to make important policy decisions. And I was the first employee my board hired. And so I needed to recruit talented people to help do this. And so we had a small but mighty team, and we wore all hats to get it done. And my board, luckily, they were all experts, and they were also willing to do staff level work. So yeah, it was, I would say nothing really prepared me for that first year. And it really was, it took a village to get it done. And we did.
Yeah. And also dealing with vendors, right? You mentioned a lot of other states looking around at each other going, well, who are you using? Who are you using? Right. And as a lawyer, I think you have a natural instinct to question everything, right? And believe nothing. And that probably is what helped get you through 2013.
Yes. So as a lawyer, I remind people I'm just naturally suspicious and I believe nothing. I verify everything. And it became clear to me that folks were looking at this ACA marketplace and the IT system we were building as a solution to everything. And so it became very clear to me early on that we were just asking our vendors to do too much in a short period of time. And it was really important to start prioritizing and focusing on what we needed to open for business on time. Everything else was extra. And so I began to say no to all the bells and whistles. And we focused only on the core functionality we needed to open for business on time. Now, it wasn't pretty, I have to say. I remember a page taking 30 seconds to load as opposed to instant, right? But by focusing and being strategic, we were able to open for business. And when I say that, I mean we opened for our small business customers. We opened our marketplace for our residents. It was really important for us to make sure that we were here to serve our entire DC community.
Yeah, I think your advice about saying no to everything that is not getting you to your minimal viable product, right, is a great lesson for founders, owners, entrepreneurs, right, who find themselves overbuilding, right?
Yes, exactly. And don't be afraid to say no. That is your job as a leader, to say no.
Yeah. I think also your consensus-based decision-making, bringing in all these stakeholders, probably led to the platform being, easily adopted because you had all of that input, from the beginning of the design.
Yes, we wanted to build from the ground up. And it wasn't to serve us. It was to make sure whatever we built worked for residents and employers who were going to be using this online health insurance marketplace. So the only way to do that, build a product that works for the community you want to serve, is to make sure they're at the table telling you what they need.
And the federal administration designated the DC Health Link as the source of coverage for Congress and their district offices, right? So that's something to be super proud of. How would you describe what that year felt like for you physically as a leader?
Yeah, so I often say it felt like a high-risk pregnancy. Every day was super challenging. And when it comes to startups and building something new, I don't want to sugarcoat it. It is really, really hard. And you have to make sure that you stay focused and strategic and you build a team that can go out and just do stuff. A high functioning, high skilled, small, mighty team that can help you get to the finish line.
It's so interesting that the federal version crashed on the same day that you opened and only 4 other states made it. What do you think those other states didn't do appropriately that led them to missing the deadline? Other than you building this high performing team, like what was the secret to your success?
My board was tremendous and they were willing to do staff work, which is super, super helpful. We had significant support from our entire community. Everyone rolled up their sleeves and were willing to pitch in. A small, talented team that I recruited, we were able to wear many hats all at once. And ultimately, the decision I made to say no to many, many important things that we were not going to be able to do for day one. I had to say no, and we had to right shift to future deployments. That really made the difference. Now, that makes people unhappy because everyone wants what they need on day one, but it's just not possible to, I call it a Christmas tree. You're not going to have the Christmas tree with all the beautiful decorations on it on day one. You have to make decisions and be committed to essentially right shifting everything else.
Yeah, that's really great. Let's talk about health benefits as a small business growth strategy. So you currently serve over 5,300 DC small businesses. You've watched some of them use health benefits brilliantly, like as a talent magnet, a retention tool, or something that actually makes them competitive with larger companies for the same people. And I assume you've also watched others treat it like a checkbox they dread once a year. What's the most important thing that a small business owner who is listening to this right now should understand about their health benefits that they probably don't? I'd love your perspective on that.
Sure. Well, if I can just go back to first talk about what problems we were seeking to solve by even building the marketplace for small businesses. And then I have advice for startups and small businesses that want to understand a little bit more about benefits. So before the Affordable Care Act, small businesses had a significant problem finding affordable health coverage that actually worked for them and their workforce. Large employers, of course, could offer a choice of many different products and insurers to their workforce, but that was not even an option for small businesses. When small businesses bought coverage, it was generally one insurance company and they couldn't offer more than one they want to offer. And we've simplified it so the small business gets one bill from us. Their employees can sign up for different companies, and we offer United Healthcare and Care First, Blue Cross Blue Shield, and Kaiser Permanente. And employees can sign up for anything. The employer gets one bill, and it's very simple. And that helps small businesses compete better against the large employers that offer these benefits. The other big difference between now and before we started is in the past, even when small businesses offered health coverage, usually their employees had to live in the area and they couldn't offer the health coverage to someone who lived in a different state. We changed all of that. So now a DC employer could have workers in Texas. And when offering coverage through DC HealthLink, their Texas workers are in network. So the small businesses can compete better for talent, both competing recruiting talent and retention of their workforce. So those were the significant problems we wanted to solve for, and we did. And also creating more competition, because with us, it's the purchasing power of more than 100,000 people that's behind us. And so insurance companies want the opportunity to get your business. So it's a little bit more price competition in terms of how affordable coverage is. And then you also asked me, well, what should employers know when making decisions and what are mistakes to avoid potentially and how to save money? Here's my advice. When I talk to startups, especially, I often hear, from the startup owner, I can't afford to contribute anything now. And that's fair. But if you, the employer, want to compete for really good people, then offer coverage. You don't have to contribute anything. In fact, once a year, we have open enrollment. So startups can come in and offer group coverage to their employees, but the employer is not required to contribute to premium. It's still good for the employees because oftentimes group coverage is less expensive than individual coverage, and it gives them access to good coverage and options they may not have on them if they had to buy individual coverage. So an employer who cannot afford to contribute, they can still come in and offer group coverage. And as they grow, and their revenue increases in the future years, they can start contributing. So don't think you cannot afford it. You can come in and not contribute, but your employees are still getting the benefit of group coverage. That's number one advice to startups. And then for businesses that are offering coverage, a cost saving measure is if your employees are pretty much in our local area, in DC, Maryland, Virginia, think about offering a local network for the health benefit plan instead of the nationwide network, because the nationwide coverage is a little bit more expensive because you have a nationwide network. If you don't have workers in Texas, then you can save money by offering coverage through a local network. So that's something to keep in mind.
Yeah, that's great advice. And I assume it's different for each business too, right? I think how a for-profit might think about their insurance benefits might be different than how a not-for-profit thinks about their insurance benefits. Is that right?
Absolutely. There is no one way that's the correct way. The correct way is what works for you, for your budget, and for your goals to recruit and retain your workforce. That's the only right answer, what works for you. What we've seen, and we serve the for-profit community as well as nonprofits, is nonprofits generally compete on benefits, not on salary. They cannot offer the same salary as for-profit companies offer. And so many of our nonprofits contribute 100% to the premium. And so their employees don't have to contribute anything. And that's an important recruitment retention tool. For our small business community, many offer coverage where they pay 100% of the premium and many don't. The one lesson to keep in mind is you as an employer, you know what your budget is, and you can pick a plan and set your budget, and you can have your employees choose any plan we offer, but your budget is set. When you give your employees a choice, they pick a plan that's better for them. So you're not making a decision for all of your workers what's the best plan for everyone, but they can choose. And also you can save money because sometimes you'll find that your employees choose a plan that's better for them and it's actually less expensive. So you're not even spending as much as you would be if you had dictated which plan all your workers should be in. So that's something else to keep in mind as well as a cost saving measure.
Yeah. Great advice. Thank you for that. So I don't mean to make this a political conversation in any way, right? But your organization exists because of a law that has been politically contested for its entire existence, the Affordable Care Act. And this happens every election cycle, every budget debate, every change in administration creates uncertainty, I would imagine, for DC HealthLink and for more than the 100,000 people who depend on it. But you've kept this running, growing, and improving through more than 12 years of that uncertainty. So what does it actually look like to lead an organization when the external environment is constantly in flux? And what have you learned over this time period about keeping a team focused on mission when the noise kind of never stops?
Yeah. So it's reality, right? For all of us, there's constant change. And as leaders, we have to recognize opportunities, whether it's locally political changes, nationally political changes, whatever it may be, economic changes, COVID, many things are beyond our control and are happening. And so as leaders, it's really important for us to recognize what is within our control and make sure we are always looking for opportunities to do things better and in a different way, and create new alliances to keep us moving forward. Now, when it comes to the politics of the Affordable Care Act, it has always been political, unfortunately. You and I know that when cancer strikes, it strikes. It doesn't ask, did you vote? Did you vote for a Republican? Did you vote for a Democrat? Right? It just strikes. Yeah. And for us, we don't ask. It doesn't matter whether our customers have ever voted. It doesn't matter if they don't agree with the Affordable Care Act, right? It just doesn't matter. It is our job to make sure that the small businesses, the nonprofits, their workers we serve, the residents we serve, that everyone has access to affordable quality health insurance that works for them. And when cancer strikes, it is our job to make sure that the health insurance they have actually works. So it works when you're healthy, it works when you're sick. And that is why we exist, and that is our job, no matter what the politics or anything else around us is happening. That's all noise. We do our job well when we get people coverage and coverage works for them.
Yeah. For a small business owner who's generally paralyzed right now by some of the uncertainty in the market, right? It could be the tariffs, it could be economy, it could be the war with Iran, whatever's affecting their business and making them wait before they make their next move. What is the practical version of that advice? I mean, what does focusing on what you can control actually look like on Monday morning?
Yep. Like for me, I may hate the air I breathe, but I cannot create clean air for myself, right? But what I can do is look at, for example, potential premium increases. And what's within my control is how I advocate for my customers. So in my example, I hire outside experts to analyze proposed premium increases, and I testify before the insurance commissioner on proposed rates. That is within my control in terms of how strong of an advocate I can be for my customers. And that is what I focus on. Not dreaming of creating clean air for myself, but really focusing on my authority, what I can do for my customers.
Yeah, you're a great storyteller. I love all of your examples. As employee number one from building something from nothing that now oversees the 100,000 people that we talked about and 5,000 small businesses and the Congress, and leading it through all of these years of uncertainty, what is the one thing that you know now that you wish someone had told you on day one? Been your lessons learned?
Great question. So moving from startup to successful ongoing enterprise was a journey, and it was really hard. Some of my leadership team members that helped us to succeed in the early years had a very difficult time transitioning. It was like kicking and screaming to transition out of startup mode. And some of my most trusted team members ended up leaving as we went through that journey. And now I recognize, which I didn't fully understand as we were moving out of our startup phase, is that some folks love startup environments, the chaos, the excitement, the no processes, right? That every day is just a new challenge and it's always kind of fifth gear, high pace. And that's okay because that's what they love to do and they should move on. Like once you're out of that startup phase, and that's not personal, that's okay. That's organizationally good in some ways, right? So that's the biggest lesson I learned. I wish I had understood it then as my team was changing. But it's really important to recognize that for leaders, especially moving from startup to ongoing, you're going to have a different trusted leadership team once you move out of the startup phase. Some will stick with you, others will move on, and that's fine. And that's success.
That's a great insight, Mila, because it's, you end up building relationships with these people that you're working with, right? And so it almost feels personal when someone makes that decision to leave the organization and you've got everything kind of working like a well-oiled machine. But people need to do what's best for them. And it's probably what the business requires at that stage, right? Because people have other skill sets that help for that next phase of growth. And so it's a really great way to think about that. Thank you for sharing that.
Yes, absolutely.
So where can our listeners learn more about the DC Health Link, find out if their business qualifies, or connect with you and what you're building?
Sure. So our online website, we are online health insurance marketplace. It's dchealthlink.com, and self-employed people, small businesses, nonprofits in DC, they can just go on our website and find out if they're eligible for our coverage. And we have anonymous shopping tools, consumer decision tools they can use. We work with about 900 brokers. These are all licensed insurance professionals that are trained by us. If they want to work with a broker, it's free, and those are experts. If a small business prefers not to work with a broker, we have an internal team that can assist. A small business can enroll year-round. They don't have to wait. It's whenever they want to start offering. We're here to help them offer affordable coverage to help grow their business.
Okay. Well, this has just been a great conversation. To all of our Think Small listeners, if you've tuned in for this, thank you. And if today's conversation changed how you think about what your health benefit strategy is actually for, or reminded you that the most valuable things that you can build as a leader are sometimes the ones that take the longest to understand, please share this episode with a founder who needs to hear it. Mila, it's been such a pleasure to have you on the show. Thank you so much for your time.
Thank you.
Welcome to the Think Small podcast, hypergrowth for small businesses. So, what's slowing you down?